welcome in. How are you today? A little bit nervous? That's okay. That's okay. Take a seat, get comfortable, and welcome to your first Botox appointment. How exciting. So today I guess what we'll be doing is going through what you would like, what you're expecting. There's some of the areas that you'd like to perhaps have treated today, and I guess what you can expect in the overall process of having Botox for the first time. Very exciting day for you, so well done. I'm glad that you're here. I have got my handy dandy clipboard here, which I'm going to use to take some notes. You'll see a very detailed picture of a face on here, and I'm going to use this to just mark the areas that we need to treat, the areas that you're most concerned about, as well as any other notes or bits of information that I may find helpful. So, to start off, can you confirm your name for me? Perfect, got the right patient, that's great. And your date of birth. Awesome. And today's time and date. It is the 25th at 1 p.m. You're on time, which is fantastic. And any allergies that you may have. Sometimes when you're having injections, things put into your body, it's good to know if there's any underlying allergies that we need to be aware of that maybe would make the procedure not appropriate. Okay, no allergies. Perfect, that's absolutely fine. Okay, so you relax, get comfortable, and we'll get everything set up and started. Okay, so I'd love to know the areas that you want to focus on. I'm going to jot them down on my beautiful detailed face drawing, and then we'll go on from there. Depending on the areas that you want to be treated, depends on the number of units and that kind of thing. So it's really great for us to have, number one, it written down, but also for me to physically see it too and investigate. So let's start by going around the face. Your forehead, the biggest area that we treat with Botox. Make some raised eyebrows for me. Okay. And that was your biggest area of concern just there? Yeah. Do that again for me. Okay. Yeah. I'm just going to note here. I'll also note the severity of it as well. Sometimes if it's a deeper wrinkle or a deeper line, it can take a longer period of time and a couple of sessions for us to actually fully eradicate it. The way that Botox works is it slightly paralyzes the muscle. It doesn't completely freeze it in all cases. I think sometimes people think that it completely stops it in its tracks. It doesn't always do that. But what it does is it just stops a lot of the movement overall. Now, when it does this, the skin can then regenerate, rejuvenate, of course, alongside a very good skincare regime and SPF protection. And over time, the skin will then begin to flatten out. What you do find is that when you start to get a bit of movement back, the wrinkle will come back. So you need to remember that Botox is a form of plastic surgery, but it does not last forever. With these things, no matter what you inject, they do not last forever. You may see some celebrities that look like it lasts forever, but I guarantee you they are having them topped up, whether they say they are or not. So, back to you. Forehead, perfect. And frown for me. Yep. Concerned there? Not so much. Okay. and smile. Let's have a look. Any crow's feet? A little bit. I'm concerned of that area too. Okay. Crow's feet down there. Okay, so do you understand the Botox procedure, how it works, what happens after today if you have it? No? Well, that's okay, don't worry. That's what we're here for. We're going to go through. I'm just going to pop my clipboard down. So, like I said, Botox, it's a type of protein. It's a little bit broken down. When we inject it into your muscle, into your forehead, there's all muscles all around this area. That's what make us move. It pretty much paralyzes the muscle. Not fully. There is still going to be some movement there, but it will hold it still. Now, Botox is actually just a brand name. The product that I use here is called Dysport. This is my favorite product in, I guess, that area of things. With this particular one, you'll find that the cost per unit is a little bit more. However, it will last for a longer period of time. With Botox, you'll find that it can kick in and you'll get your full look within a couple of days, but it will wean off after a few months. With Dysport, what I like about this is it takes 2 weeks to fully get to its strength, but it will last for a longer period of time after that. So when I last had mine done, probably about 3 months ago, I've still got, I guess, minimal movement. If I really scrunch my forehead, I can bring it in. But it's still there. It's still in full force, which is fantastic. Better value for money, which is what I always want for my patients, is value for money. So what I'm going to do now is just lean in and have a closer look at your skin, if that's okay. Perfect. Okay, so if you could just scrunch your forehead for me. Perfect. I'm just gonna scrunch it again and hold. And stop. Perfect. Make a frown for me. Excellent. Okay, that's fine. And smile. Just said something really funny. Let's have a look. Got a couple of little crow's feet here. Okay, that's totally fine. We can definitely work with this. Let's just have a look and raise your eyebrows for me again. Perfect. Okay, excellent. That's great. Okay, so we've had a good look at your skin. Your skin looks really hydrated and healthy, actually. I'm very impressed. We get a lot of patients that, don't have that, and that definitely impacts the effectiveness of this procedure, but also your overall skin health. It's very important that you moisturize, exfoliate, use sun protection every day, and you're definitely doing that, so that's fantastic. What I'm going to do is just, now we've looked at your skin, had a look at the areas of concern, I'm just going to allocate the amount of units that I think we need to pop in. Units are, I guess it's just the measurement of the product that we're going to use. There is a cost per unit. I charge $2 per unit. So I'm just going to have a look, because it is your first time, we don't want to go too heavy. I would much rather put in a little bit less, and in a couple of weeks' time, when you come back for your checkup, you can have more put in. You don't want to go too hard too soon. It may freak some people out. Some people want to get used to it gradually, but also you don't want your skin to immediately, have a bad reaction or something like that. Not that that's likely to happen, but you've got to be careful these days. So we want to go for all 4 areas. That's the forehead 1, frown lines 2, crow's feet 3 and 4. Yeah. So 4 areas. Now I'm gonna say frown for me again? Yeah. Yeah, okay. So let's do 3, 4. Let's say 5 units for your frown. That's 1, 2, 3, 4, 5. Thereabouts. Obviously I'm over exaggerating so you can see on my face, but in this V region here. Then let's go, raise your eyebrows for me. Okay, 1, 2, again, 3, 4, 13. I'm going to do 14 for the forehead. So that's 7 across the top, 7 across this center area here. It'll pretty much go in this whole area. Yep, perfect. And smile. Let's have a look. Perfect. And the other side. Excellent. 2, 3. So we've got 14 on the forehead, 5 on the frown, 10 on there, 24, 5, 6, 7, 8, 9. So it's 29 units overall for your first treatment. Perfect. Okay. Yeah. So look, some people do just get this area done rather than the whole thing. I don't necessarily suggest that. The reason being, all of your muscles on your face, in fact all of your muscles in your body, work in unison with each other. If one part stops working, the other part will try and overcompensate for it. So what you find is people will have this area done, not here. This area then moves a lot more and wrinkles faster. Vice versa. People have this area done, not here. Again, this starts to move a little bit more to overcompensate for the lack of movement here, and you'll find that again it wrinkles a lot faster. So we just have to be careful with that kind of thing. The way that I like to do it is very, very, very evenly spread, very natural. We don't want to go too crazy over there. Okay, so that's all fine. Are you comfortable with that? You wanna see the needle? Absolutely, of course. Oh my gosh, yes. So pop this down again. I love these 4-colored pens. They're just great, aren't they? So this is the little bottle of Dysport that we're going to use. This actually gets kept in the refrigerator, and we've got a little syringe here, and you can see the needle tip just on the very end. It's actually so small that you can barely even see it. Now we'll use a few of these, it won't just be one. You do have to be careful because the needle tip, they are very small and very sharp, but they blunt after a couple of uses. So we'll have about 6 or 7 different syringes here set up for you. Feeling better about that now? Yeah, of course. No, absolutely. I totally get that. So I'm just going to get myself all prepared and set up. We've got a couple of different syringes here. I like to get the syringes ready first, and then I'll prepare your skin. Now the reason I like to do that is just so the syringes, the product in there can just settle for a moment. Any air bubbles will obviously squeeze out. They just, it's just the way that I do things. So I'm just gonna get this all prepared. Excellent. What's what made you look for Botox? Got friends that do it, or yeah? No, absolutely. Look, I think with this kind of thing, it's great to want to feel your best, and look your best, and do your best. As long as we remember that really, truly, it is what's on the inside that counts. That's what makes the biggest difference. I'm just going to use this there. Excellent. Okay, so syringes are pretty much ready. We just now need to prepare your skin. I'll also give you a little lollipop to have while you're in the chair. Some people get a bit nervous when they're having their Botox for the first time, and a lollipop in the mouth just helps people take their mind off it. The sugar helps you to, just relax a little bit and stay calm. So I have a little solution here. Nothing crazy, just some micellar water. This is going to just cleanse your skin, remove any pollution, any dirt. If you've got any makeup on there by chance, and it will just get rid of all of that. I'm just going to pop it on here. Okay. And then we're just going to, want to get that on my hand properly. I'm just going to just want to get in around your frown line just to make sure it's all clean. Excellent, thank you. We'll just let that dry for a second, and then I'm actually going to go on top of that with a alcohol wipe. Now this is just to make sure that your skin is sterile, it's clean and ready for the injection. These particular alcohol wipes, they will dry your skin out, so when you get home you'll want to just gently moisturize, just to make sure you keep your beautiful lovely glow. So just get that ready. Excellent. And just sit back for me. Perfect. Just gonna go in here with the, there we go. That's perfect. Well done. Excellent. Okay, now you are all ready for your first Botox injections. How exciting. So all you'll have is a sharp scratch. You won't feel too much. If you do have any major discomfort, or you just feel a bit funny, you want to stop for a second, please just let me know. We can do so, that's absolutely fine. Okay, so I'm just going to come in real close and raise your forehead for me. Perfect. Sharp scratch. How was that? Perfect. And again for me. And sharp scratch. Perfect. And again for me. Sharp scratch. Okay, that's one needle done. Is that feeling okay? Okay, excellent. Alright now. And raise your forehead again for me. Sharp scratch. And we're done. And again. Sharp scratch. Done. And sharp scratch. Perfect. Sharp scratch. Okay. Let's get the other one now. And raise again for me. Excellent. Sharp scratch. And again for me. Perfect. Sharp scratch. Excellent. Okay. Then we're going to move on to your frown lines now, okay? And do a big frown for me. Excellent. Sharp scratch. Perfect. And let's go again. Okay, awesome. Sharp scratch. And again, sharp scratch. Perfect. You're doing really well here. This is great. Let's just do your crow's feet on this side here. And let's go. And sharp scratch. Smile for me. Thank you. Sharp scratch. Okay, excellent. Sharp scratch. Perfect. almost done. This is fantastic. Okay, and just on this side now. And 3, 2, 1, sharp scratch. 3, 2, 1, sharp scratch. And one last one. Excellent. Okay, how does that feel? Yeah? Not as bad as you thought? Excellent, that's great. That's fantastic. So, what I'm going to do now is just, I've got another, gosh, I've got so many little pads here to wipe on your skin, haven't I? I'm just going to wipe this cooling gel over the top, and what it will do is just seal up any little holes, make sure there's no bleeding. It'll also just help to prevent any bruising in the future. If you do get minor bruising, it's totally normal. You may also get some very small little bumps. Again, totally normal. It's just your skin's natural reaction to an injection, and they usually disappear within 1 to 2 days. So let's just wipe, 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 wipe. Perfect. You've actually done very, very well for your first time. Usually people are a little bit more nervous and a bit scared. So what we'll be looking to do now is we'll book you in for 2 weeks time. Remember what I said about Dysport? It takes 2 weeks to fully kick in. So over the next 2 weeks, you're going to want to be really careful with your forehead area. No wearing a tight hat or helmet, laying on the front of your face. If you like to get massages, I would avoid anything to do with putting pressure on your face for the next couple of weeks. Just for the next 24 hours, no strenuous exercise. You want to make sure that your forehead stays nice and relaxed, so no going to the gym, and I would avoid anything that makes you sweat profusely for about 24-48 hours as well. If you did have any concerns, of course, you can always come back to me. You can call me, text me, you can find me on my YouTube, whatever you need to do, that's absolutely fine. And before you go, I will just sign this off to say what we've done. I'll also make a note just to say, let me just check, yep, no issues on skin, perfect, and just checking everything else, absolutely fine, okay. So if I could just get you to sign that for me. Excellent, thank you. And then I will actually photocopy this and email you a copy as well. Seems a bit old school, I know, doing everything on pen and paper, but I just like it like that. It's a little bit easier, you know. The pen makes a nice sound. I can choose my different colours, so it works well for me. Awesome, well, thank you so much. And yeah, like I said, if you need anything, then just let me know. Awesome, I'll see you soon. Thanks.